Many people in leadership applauded my efforts because they were so used to us rolling over and just taking it because this is my good government job. And I had to say, I need to work, but I don't need to work here. I'm going to stand up for myself and let the chips fall where they may. But no, you're not going to do me like that.
That was Dr. Katasha Butler, Medication and Regulatory Coordinator at Eskenazi Health, talking about her awesome and unique experience in leading people in the healthcare industry and as a pharmacist. And this is IBJ's The Freedom Forum with Angela B. Freeman. Good morning, Dr. Butler. I hope it's okay if I call you Katasha.
That is okay.
Oh, yeah. Great. So I want to thank you for being here and welcome to the Freedom Forum. You are one of the most accomplished women professionals in this city. I'm so excited to have this conversation with you today. But before we get started, I would like for you to tell us, our listeners, a bit about you, your educational and professional background, and any factors that have led to you becoming the Medication and Regulatory Coordinator at Eskenazi.
Sure thing. First, I would like to say thank you for inviting me to be a guest on this podcast. I really appreciate you thinking about me. We met, some time ago.
Yeah,
and
a few years ago.
And I know that you have a science background, so, that's a person after my own heart. I was chemistry major in undergrad, so that's what I do. And of course, pharmacy is science on its face, but what I do at Eskenazi is medication use process, regulatory compliance, and strategic initiatives. It's a really long title that basically boils down to formulary management. What are the best medications that we can offer to our patients for their conditions and still be cost effective in the health system?
Wow.
And all of the processes that surround that. So that's, can we get it? How do we get it? How do we store it? How do we distribute it? How do people know what's available once we introduce it to the system? Is it working in the way that we anticipated it working? Are there any adverse events that we didn't expect? Are people using it the way that they are supposed to use it and the way that we thought that they were going to use it? So that's 1/3 of the role. The second part is regulatory compliance. Pharmacy is very highly regulated. Everything we do is regulated. For instance, you can't even walk into our space if you don't have a licensed individual who is there, present, and available. So everything that we need for accreditation purposes, I need to make sure that the pharmacy department, in tandem with the health organization as a whole, is meeting those requirements. If we don't get accredited, we're dead in the water. I'm dead in my job. So that's the second third. And then the last third, strategic initiatives, strategic partnerships. We cannot operate in a vacuum. And so who are those partners, either within the organization or outside the organization, that we need to be in connection and collaboration with to further the mission, the vision of Eskenazi, and the mission of our department? We have departmental goals that we must meet. Our ultimate goal is to make sure that we are caring for our patients in the best way possible so they can have the best health outcomes. And so pharmacy is a large part of that. And so that strategic initiatives sets the game plan of how we are going to meet those goals. So those are all the components of my job. I am a member of the leadership team. I will be at Eskenazi for 6 years. I love my job still today. And for me, who is a person who likes change, that is significant. About year 4 or 5, there may be something else out here for me to do. I love my job. I love my team. I love the organization and how they empower us to be able to work. And so I think it's great. I always tell people I'm not a native Hoosier. I've been here since the 90s because I came here to go to pharmacy school at Butler University. But I'm a neighbor. I'm a native Illinoisan. And Indianapolis has always been like home. I used to come here for the summers as a child. And so it wasn't very far-fetched for me to make my place here.
Wow, that is so fascinating. You've already educated me, and I'm sure many of our listeners, on all that goes into you getting your medications. Like, I suspect many people don't give that a second thought, all the regulation and oversight that actually goes into that.
Oh, for sure. A lot of times most people's entree into medication is your community pharmacist,
Right.
which is very important. I work community pharmacy as well. I've been a pharmacist for over 20 years. I've worked community pharmacy for a really long time. I always worked in what I call the neighborhood
Right.
because they needed us there. We were their first point of contact for healthcare. And most people know pharmacy in that way. But I have an example that people can understand. When COVID started, they were rolling out vaccines. Some of the vaccines they needed what we call deep freeze storage. And so the ability to be below zero storage. You really can't have those types of freezers in a community pharmacy. So they had to select a different vaccine. Before we decided, yes, we are going to carry this particular vaccine, can we have access to that storage so we can deliver this medication safely?
Right.
And so all of those are pieces and parts of what we call medication use process. And it's a lot that goes into it. It's just not new medications roll out and we'd be like, yep, we're going to have it. We just, with the being good stewards of resources, it just doesn't work like that. We need to make sure that we have the best medication that will deliver the best outcomes for our patient population and to keep our health system strong.
That's so fascinating. So I want to talk to you about your career path. You told me that you started off with a BS in chemistry, and I know that is from a famous HBCU, Spelman College. We just had another Spelman grad, Tiffany Munsell, on a couple episodes ago. Yeah, and she talked about how Spelman was so impactful for her career, for her confidence, for just coming in as a young person and getting and transitioning into the business world and into the corporate environment. I'd like to know, how did Spelman make an impact on you?
For sure. Spelman is definitely a large part of my story. I told you I'm a native Illinoisan. I'm from, not Chicago, I'm from East Central Illinois, farms and corn and all that good stuff. I'm by Champaign, Illinois. I'm from Danville. And I grew up, I was one of two people. I was in a gifted program. It was one black girl, one black boy. And that was me from fourth grade all the way until I graduated. I lived in a community of Black families, but we spend, just like we're at work for the most of the day, I'm at school for most of the day. And so I thought I was going to be at the University of Illinois. It was Big Ten, excellent school. I've been going there for summer programs. I had already decided I was going to be a pharmacist. It's okay, that's where I'm going to go. Snap decision, Thanksgiving weekend of my senior year. So really, I'm at the end. It's the end of the road. Already I'm just going to go to U of I. Had a classmate. He was a year ahead of me. He went to Morehouse and he came home for Thanksgiving. And he was like, I think you need to go there. You will love it. I just think that you need to look at Spelman. And I was like, I think you're right. And so this was Thanksgiving weekend. Early decision was December 1st.
Wow.
I applied early decision and I got in. And then I was like, that's where I'm going. I had never been down there. I've heard about it because it is a storied HBCU, rightfully so. And so that was the only school I ended up actually applying to. And so I'm there. My parents take me down there. At first, my dad had to get over it because he was like, girl, I thought you were going to Champaign, 30 minutes away. No, I'm going to Atlanta.
Right.
Don't know anybody down there. We don't have family down there. Now they have to reconfigure. Now we got to get you down here. What is financial aid looking like? Because I have scholarships that were already going to be lined up at the U of I.
Sure.
So thankfully, I did get a scholarship to Spelman. Of course, scholarships at Spelman, if you ain't getting a full ride, scholarship is relative. But I had other scholarships because I was a scholar. I get down there, and I just said I was one of two Black people. So in the gifted program, every class, it was one Black boy, one Black girl. I get down there, and it's 2,500 Black girls. And they're all like me. is in everybody is stellar. Everybody is producing. I had 2 roommates who we are friends to this day. Then we had 4 suites down there. We are all still friends. And one thing that stands out is everybody did what they said they were going to do, which is phenomenal. It was like 12 of us down there. One of my roommates, she was like, "Yeah, I'm gonna go." She wanted to be a doctor, and she was so flighty. Love her, and we'd be like, "Girl, you what?" She is somebody's physician today.
Yeah, that's awesome.
My other roommate wanted to be an attorney, went to Georgetown. I said I was gonna be a pharmacist. I am a pharmacist because that is the support that you get. Like, you're down there amongst like, everybody's on their A game and supportive. And I just learned so much coming from rural Illinois, going down to Atlanta in the 90s. I was there for all the stuff. And when we get together, we just had a 25th, and we got together for 25 years. And one of my friends who is the CEO of the LA Doctors Foundation, these girls are doing it. And she just said to me, she was like, "Katasha, you were always so focused." She was just like, "You were just like this, I'm going to do this and this." I didn't even recognize that about myself at that time. But when she gave it back to me, and I just am thankful for that. I'm thankful for the tribe that Spelman gave me. I went to Butler University after Spelman, which is Spelman in reverse. Love Butler. Love that I got my pharmacy education from there because it is a phenomenal school. But it's different. And I didn't necessarily always feel that they were for me. I think going to Spelman first gave me the fortitude to withstand the things that I had to deal with at Butler.
I think that's awesome. And it's a story that gets reiterated over and over again by so many HBCU grads. I've had several on this show and just know several, just friends of mine. I didn't have that experience, but I absolutely appreciate what it gives and the confidence it builds to go into environments and organizations where certainly if you're in STEM, you're not going to be in any kind of major diverse environment. And you have to have the confidence to know you belong, you've earned it, you're valuable, and that you can make difference and impact.
When I was at pharmacy school, I got accused of plagiarism on a paper. When I was in middle school, I started saying 4th grade, I've been in a gifted program. I was spelling team I like all of middle school. I went to Spelman, #1 HBCU in the country and running. And a professor pulled my paper because I had the word synergy in it. And so my classmates were like, "You should feel honored because you write so well that he think you plagiarizing." That is not an honor.
Yeah.
Because what I feel like is he don't think that I can write well. And it's not because you know me or my background. It's just because of your perception of me. And dealing with that, having to bring in books, and I know people like going verbatim out of the book and they're just skating through. And he looking at me because of the word synergy. One of my turnaround moments, full circle moments, is I got published in the Annals of Pharmacotherapy. And I know he subscribed to it. And I know he saw it. And that happened.
Let that speak for itself.
Right. Let that speak for itself. But you call synergy?
Right.
I was spelling that in the 6th grade.
Right. But that's a good example, a perfect example of how bias plays itself out in a way that affects diverse professionals all day, every day. Somebody thinks you are not as smart or projecting to be smarter than you are, or you don't belong because how could she possibly be this good or have made these grades by herself? They must have cheated, must have done something. That's bias. It's no different than looking at a resume and saying, wait, this is a person of color or a person who's diverse. How could they possibly be this accomplished or have this many credentials or experiences?
Right. And how I knew it was just personal bias is because group papers. I was the author of the group papers. And so when it was in a group, we got it.
Right.
If it was just me, I could never get an A.
Interesting. Thank you for sharing that, because that's real life examples and it's a perfect. I want to ask you about you going from Spelman to Butler. You've told us some about that experience, but I'm also want to know, you got your MBA and your PharmD. I want to know, what was your motivation to get both of those degrees? That's why I said you're one of the most accomplished people in this city. Like, you have so many credentials. What was the motivation to get both of those degrees? What did you think they would add to your career?
Right. So I actually did them backwards. I went and got my PharmD first. And pharmacy is very highly specialized, and they compensate us. I would love more compensation, but we're compensated well. So when you come into a job with a PharmD, they want you to do pharmacy work. And so I had a great executive when I worked for Ascension, and he said, if you want to expand in the healthcare space and just not be looked at as a pharmacy expert, you need to get a generalized degree. And so I had been sitting on the fence about, I want to go and get an MBA, but I was like, I'm in school forever. I've had a successful career so far. I had been in leadership for many years before I even went and got an MBA. And so he put that bug in my ear, and I didn't want to be pigeonholed. And so I was sitting on it. And actually, a friend that we have in common, he called me out of the blue one day. He was like, I'm thinking about going to get an MBA at Butler. They have an open house. You should come with me. And I was like, okay. Then 30 days later, we were in the program.
That's awesome.
And so it was the seeds that I knew I had to do it if I wanted to keep going. Just fatigue of being in school, career. I had opened a business. At that time, I opened a banquet event center in my hometown with one of my childhood friends. There was a lot going on. And then I put an MBA on top of it and a full-time night school for an adult. But you just got to go through it. That's what I tell people. Degree as an adult is a test of endurance.
Absolutely.
So I'm working in the day. I have this business. My classmates would be like, girl, you always just look busy. Yes, I'm out here writing contracts. I'm in business school, running a business and figuring out how to make it work. And so I did very well in that program, which helped me solidify my career path. One of the classes that I did very well in was operations. I wrote this paper and it was so good. My professor, he gave me a 100 on it, and he was like, I don't do that. And I actually think he used some of of what I wrote. It was a plan on how to operationalize decentralized human resources or something like that. I feel like he used some of it because the company that he worked for, they started doing some of those things. But it made me know that's my strength. I can go in and look and assess the situation, see what's going on, see where it should be, and then figure out how to get there. I don't want to do to get there.
But I can lay you out a plan to get there.
I can let you do the plans. I think that's my creative mind. I don't like to stay on something too long, which is why I enjoy what I do with Eskenazi, because I can lay the foundation, look at it. This is where we are. This is where we should be. This is how we should get there. These are the people. Now let me go and work on another problem.
That's awesome. And I appreciate that because, again, that MBA consideration has been mentioned a couple times. And I really appreciate learning the value that it has, particularly to somebody like yourself who's already, so to your point, I agree, that's already so credentialed and accomplished. So appreciating how that broadened your opportunities and your abilities to do different things and not be pigeonholed. I want to ask you, though, about the pharmacy. I can appreciate that. We all know there are not that many, or being a medical doctor is as least diverse as any other profession. And I must believe being a African-American female pharmacist is even less diverse than your typical medical doctor. So I want to know about that experience. You said you knew you wanted to be a pharmacist since early on. How did you even know what a pharmacist does? How did you get exposed to that and decide so early on, this is what I want to do, and carry it through?
It goes all the way back to grade school. I used to be a walker in the neighborhood. So we walked to the neighborhood school, and we had a Hooks that we used to go in for candy. And it was the old Hooks. If you remember, the pharmacist would be up looking out over the whole store. And I would see them all the time. I was second, third grade, and I would be like, they look like they was chilling back there. That's what I said when I was a freshman at Spelman. I must have told my classmates, but they looked like they was chilling. That was my word, chilling. I know. I now know they do not chill. It was a lot of work going on back there. But I was like, I look like I could do that. And I was just going in there for candy. So fast forward, I'm going through my education. Now I am considered gifted and talented. Everybody know you're going to go to medical school. I don't like body fluids. Can't do it.
Yeah, me too.
And I was like,
Yeah.
like I knew I could not do that. But that was the expectation. So I was like, no, I'm going to be a pharmacist because they look like they was back there chilling. I decided it then, but then I had my detour and went to Spelman because I really could have went straight into pre-pharm pharmacy school right off the bat. Went to Butler straight out, but that was a God divine detour that I needed, that I didn't know I needed until I knew I needed it. And so that was basically it. I was like, I know I'm not going to be a medical doctor because that's not my ministry. I'm going to be a pharmacist. It is science heavy. It's still in healthcare. I still get to help people. And so that's how, that tunnel vision that my friend told me about, that's what I was doing. So even though I was a chemistry major, everything I did was about getting in pharmacy school.
So let me ask you this. When you were seeing the pharmacists at Hooks that looked like they were chilling, you're like, that's what I'm going to do. Was that person or those people, were they people of color? Were they diverse people?
No, they were not.
Okay.
And back then it was white males.
Yeah. Yeah.
That's all you would see. But I knew me going to the pharmacist as a child when I'm sick or my mother getting me medication.
Sure.
So they're in healthcare. And then I started exploring the options in high school just through different junior league, different programs when I would do summer programs at the U of I, just looking more into the industry and getting that experience and exposure. And I was like, this is right for me.
Right.
And for my mind.
Yeah.
And what I like to do.
Exposure's everything. I say that. I wouldn't be a patent attorney today without someone exposing me to the opportunity. Never knew that existed. Never knew it was a thing until I did. And to your point, as soon as I heard, I'm like, that's me. I want to pursue that. So I think that's amazing. So I want to ask you about your specific qualities, characteristics, or skills. You've already said that you were smart, obviously, in the high-performing accelerated programs from early on. Clearly, intellectually blessed. But what other skills? Because you said you've also been in leadership for years and years at this point. So what skills, qualities, or characteristics do you think empower you or have empowered you over the course of your career to really make you successful beyond just the accreditation and the academics?
Sure thing. I have to give credit to my upbringing and my parents. Number one, it was my parents that whatever we wanted to do or whatever you thought you wanted to do, they were like, yep, you can do it. You can do that. And we're going to figure out how to get you to whatever you need and however you're going to do it. Yes, you can do that. And so I think that was the foundation. It doesn't have to be your mom and dad. It could be an uncle, your grandmother, whoever the adult is in your life that pushes you and acknowledges your talents and skills. So I grew up in life thinking, if that's something I want to do and I can get it done. And sometimes I think about how I process things and I say, was I trained to be like this in pharmacy school or was I already like this, which made me want to go to pharmacy school? Because the way that we are trained, that's why I said I love that I have a Butler PharmD, excellent school. How we think about things and process questions and process problems and keeping the patient at the forefront of everything that we do. And so I think part of it was my own personal drive, the push from my family life that whatever you trying to achieve, you couldn't tell me no.
Yeah.
Or you're going to have to tell me no 3-4 times, and then I'm going to approach it from a different angle to see if I can get it done or get what I need from you. So that was number one. And then number two, just paying attention. I became a pharmacy leader like 8 months after I graduated pharmacy school, which really was crazy. leading. I was a clinical director 8 months after I passed my boards. And it happens like that for a lot of healthcare professionals. They expect you to be a leader.
Right.
And so I'm in this federally qualified health center, and they're in the red, and I got employees reporting to me, and they're depending on the decisions that I make for their livelihood, because I can either make the department thrive or I can get it shut down. Knowing people, learning along the way. I'm not a person who, I don't have to experience the problem to know that it's a problem.
Right.
If I see if it's a problem for you, then I'm going to figure out, I'm going to do something else. I don't have to touch the stove to know that it's hot. You
Right.
told me it was hot. And I think a part of that also helped me always having a plan A, B, C, and D. I don't know if that's a good thing. Now everything is like mental health based. Maybe that's a trauma response. I don't know if it's trauma response. Maybe I feel like it's just being prepared. I always have an alternative and just thinking ahead. And I think people appreciate that. They can trust me. Learning by mistakes. I got into some, I don't want to call it was an eye opener, because that going back to, am I trained like that or was I already like that? I'm a black and white person at my core. Tell me what you want and tell me when you need it and how you want me to deliver it to you. And that's all I need you to do, and I'm going to get it done. Being a people leader, everybody is not like that.
Right,
I got to
right.
talk to you. How's
Right.
your child? Did the dog eat all right? And early on in my career, so I told you I became a director at FQHC, then I left, and then I became a clinical director at a managed care company, a huge managed care company here in Indianapolis. And I had my blue employee, and I think I just asked her, like, what happened? Something was supposed to take place. It didn't take place. I sent her an email with 2 question marks. I just want to know what happened. I'm not mad about it. Things happen. Oh, she turned me into HR. And she's mean and hateful. And look how she talking to me. Look at this email. And I was like, girl, what are you talking about? I just want to know what happened. That was a turning point for me. Like, just because that's the way that I receive information and that's how I like to work, that does not work. And if you are going to be a people leader, you have to give it to them how they need to receive it. Because my job is to get everybody rowing in the same direction to meet the metrics of this organization. That's my job. How do I get them rowing in the same direction? So whatever I need to do, then that's what I need to do. I could have been like, that's the way I am, and they just gonna have to.
Yeah.
And I would be fighting an uphill battle every day. I'm not trying to do that. I need everybody to come to work, do what they're supposed to do, and we all, come out on top on the other side. And so that was I mad at the moment? I don't know. I wasn't mad. I was just like, girl, tripping. But I tell my residents that story. I tell my students that story because that became a basis of my leadership style. Tell me who you are, what's important to you, and I'm going to help you with that. And we're going to all move forward together because that's my job as a leader. And that's how I just started leading. And I feel like that's how I've been successful as a leader. People say you need to leave your problems at the door. That's not reality.
Right.
People come to work with their whole selves and whatever they have going on, including me. And if I know you dealing with a problem, you got a sick child,
Right.
I need you to take care of that. We're going to get through this. But me allowing people that space, talking to them how they want to be talked to, I have helped people leave my department. Pharmacy is the end for me because I have a PharmD.
Right.
That's a terminal degree. You in here working as a clinical tech, this may not be your last stop. And I can
Absolutely.
appreciate that. So what do you want to do? Let me help you get there because I want you to be a whole person, whether you work for me or not.
I think that is so powerful. And it's great. I've had that same training and understanding that there's a huge difference between being a technical leader or a subject matter expert and a people leader. Those are different skill sets. And I've seen it over the course of the years. We've seen it when I was at Lilly. The best scientist becomes the manager of the org. But those are not people leaders, or some of them have developed into that. To your point, it takes development. It takes realizing that you're using a different skill set, but you have to get people engaged, which means you do have to get involved with folks. So if you don't want to talk and know all the ins and outs, then that may not be the best fit for you.
Exactly. And you said it right. Like I said, pharmacy is very technical and it is what it is. And we black and white, because if we're not black and white, somebody could be harmed.
Right.
But people don't operate like that. And so I could have been like the best pharmacist ever and a terrible boss.
Right. Absolutely. And there's plenty of those people out there,
Right.
plenty, which is why people are challenged.
And that's, you can't move the needle. I know what it is for me. If I'm here as a leader, my responsibility is to carry out what the organization wants me to carry out. And I know as an employee, you worry about what's in it for you. And I'm not mad at you.
Right.
Having that understanding has helped me over the last 20-something years. Like I said, 8 months, I got a leadership role. So I have been a leader the most of my pharmacy career. And just taking what I've learned, I've had some bumps and bruises. I remember when I had to fire my first person, I boo-hoo cried.
Yeah.
And then I had to be like, well, she fired herself.
Right.
Because there are things that were required of her, and she actively chose not to do it. And then and what you gonna do? Okay.
Yeah.
But I cried.
Yeah, because it's real for folks.
Right.
Yeah. But see, that's what we're talking about is empathy. You know how it is to be in a situation where you're the person who has to provide, or you're the person who's lost a job. And maybe you've never lost a job, but you know somebody who has. And the challenges that present. That just means you are an empathetic leader, which makes you a good leader. The challenge is we have too many leaders who cannot put themselves in somebody else's shoes, who cannot appreciate that, you know what, I just was up all night dealing with a sick child or a sick parent, or I had to go to the hospital, or I had to go pick my son up from jail, or whatever it is. Like, whatever the issues are that, and yeah, I showed up late for work, or I didn't get this done or that done. And you're right. If that's just a everyday occurrence, then that's a problem. But if it's a good person who typically give them some grace.
You have to give people grace.
Yeah,
all
life
the time.
happens.
And just because it ain't never happened to me, don't mean it could happen to somebody I know.
Absolutely.
It could happen to a family. Like, just because you haven't experienced it, don't mean you won't. Or you probably know somebody, and just be empathetic to people's situations. I'm no stranger to discipline. I'm going to give it to you straight.
Yeah, for sure.
You can rise or you can fall, but I'm going to help you along the way. But if you got to go, you got to go.
That's right. Absolutely. And that's part of being a leader, too. You got to know when, okay, this is the weakest link in the chain, and yeah, you have to go. But also, and so that's what makes a good leader, being able to have that balance, that sight, that vision, and know when your people are working well and when, okay, this isn't a great fit and you need to move on. I think that's amazing, though, because I know the people who lead like that, their people love them. And if you can get that buy-in, they will jump through.
And that's what
absolutely.
I tell my learners. It's almost selfish, because I could get my employees to do anything for me because they know I would go to bat and do anything that I could for them.
Yeah, absolutely.
And they know it was genuine.
Yeah.
Information. I'm not a hoarder. Information. If it's something you can know, you're going to know it. Because that's what I expect when you are carrying out your role. But my employees, I still get from old employees, I just got this promotion and I want to thank you because you pushed me to do X, Y, and Z. I still get those inbox. I still get asked for character references from people that were my employees 10 years ago.
Absolutely.
They still reach out to me. That, for me, is the validation.
Absolutely. And that's life-changing. That's when you know your leadership has truly impacted lives, has improved lives, has put people on trajectories and career paths that they otherwise may have never seen for themselves, never aspired to. That's what leadership is. It's looking and seeing the potential. Not all the downfalls and issues, there's going to be that. But how can this person continue to be their best self? And if it's not in my organization or my department or my...
It's fine. It's about loving and appreciating people. Like,
Absolutely.
I want you to be the best whether you work for me or not.
Absolutely.
Because if you're not happy here, you're going to leave anyway.
Absolutely. That's
I can't
exactly
keep
right.
you if this is not where you really want to be. Let me help you. I used to make my employees, everybody had to do something developmental. It don't even have to do anything with the job. But if it's some type of enrichment courses that we offer, I used to work for the federal government. Take two, you get two a year. You don't have to do with pharmacy, nothing. I want you to enrich yourself.
Yeah.
I had a janitor. I told you pharmacy is highly regulated. So we had one person who would come in the evenings. That was our person. I helped him come out of EVS and go to surgery. Just talking to him, and I think you should do it. Let me help you. Let's prepare for the interview. He didn't even belong to me.
All right.
But I just want people to excel.
Yeah.
Whatever that is for
Absolutely.
you, that's what I want for you.
Now it's time for a break.
Get caught up on the state's top business news every business day with the Inside Indiana Business Radio On Demand podcast. Available now at InsideIndianaBusiness.com, Apple Podcasts, Spotify, or wherever you get your podcasts.
We're back with Dr. Katasha Butler, Medication and Regulatory Coordinator at Eskenazi Health, on this 47th episode of the Freedom Forum with Angela B. Freeman. Let's get back to the healthcare piece, because you've been in healthcare for 20 years. You've had all kind of experiences, and you mentioned briefly, I know I've talked with several other people, Nicole Wilson and other who are in healthcare, who've talked about how diversity and inclusion have changed, like the thoughts around that have changed in the healthcare industry over the last 2 decades. One of my examples is, I remember when I was at Lilly years ago, long before I became a patent attorney, and it was all about getting diversity in clinical trials, making sure that the data that we're gathering in clinical trials is relevant to all the patient populations. And obviously that can't be the case if you're only testing drugs or giving trials on particular patient populations. So how have you seen inclusivity, diversity change, or the thoughts around that change over the course of your time in healthcare? And how does that resonate for you in your role as a pharmacist, as a leader of people in a healthcare system or a hospital system?
As I look back over my career, I've had the privilege of working with the underserved and underinsured for a long time. I told you I did community pharmacy in the neighborhood.
Right.
18th in Illinois, 38th in Emerson. Then I went to a FQHC. They take care of the underinsured patient population. It was only for a short amount of time when I worked for Ascension that the patient population changed. Then I went to federal government. Those are the same type of patients. And so the needs are different. You have to be able to meet them where they are. Number one, you talked about clinical trials. We're still having those issues.
Yeah.
Alzheimer's disease, breast cancer. We still need minority populations to take place in those clinical trials. Our bodies are different. Our genetic makeup is different. We react to medications differently. This is a known fact. If we want to see the cures, we need to be a part of the solution. I understand why we are not a part of the solution, but it's just a fact. We need to be a part of that. My eyes have been open working with the patient population. It is also a proven fact that people are more comfortable around those who look like them. Your health outcomes are better because I can talk to a patient who has the same background as me differently to get the point across, to get them to get what they needed. I remember I'm a student at Butler. I'm working at 38th in Illinois, and I'm looking like this. I didn't get it. I'm like, why are these people grocery shopping at CVS? It's $100 for 5 items.
Right.
This is back in the day. And somebody explained to me before food deserts and things became a popular term, this is all they have access to.
Yeah.
I didn't understand it at the outset. This is the only place they can come. I'm the only person, the pharmacist at the time, because I'm still an intern. This is your point of contact for healthcare. So we got to make the most of it in our little bit of time for you. I used to have one of our patients, Mr. Jones, and that sounds like a pseudonym, but that was his name. He was no longer with us. Severe asthmatic patient. And would come, you got 2 puffs left in that albuterol inhaler. And finally, have to be like, Mr. Jones, bro, we talked last time. You can't come in here. This is all you have left. You may not make it. Just different ways to talk to patients. All right, Miss Lady, I'm going to get it together next time. Just helping him, just being more compliant. Black people don't like generics. I think I know why. We have money to pay for brand name now. But that's a waste of money. I need you to maximize your dollars.
Right.
And so I used to tell them, I would be like, I make my grandmother take generic medications. And I was like, I love her. So I wouldn't tell you to do anything different that I'm telling my own grandmother. All right, okay, I'm going to try it. So now you're paying $3 instead of $400.
And getting the same care.
And getting the same care and the same outcomes. Just me, I know why you're getting brand name medications. And it's just a different comfort level. Even when they upset with you, I know how to talk to you. And so that is very much needed. We need healthcare professionals that patients can be comfortable with so they can do what they need to do to get the best outcomes possible.
And that's also a matter of education. Even in my field, I appreciate that when I'm talking to, for my example, small business owners or diverse business owners, there's a lot of education that goes in our conversations. Whereas oftentimes other professionals, they're just telling you this is what you need to do, but you have to explain why you need to do that. Why is it going to be a better health outcome or the same health outcome and allow you to save more money so that you can pay for other things that we know you need in your life?
Exactly.
And when it's a person who understands or it's empathetic or has been there, it's not a class issue. It's not a hierarchy issue. It's I'm looking out for you. And I'm telling you, to your point, exactly what I tell my own mother, what I tell my own parents, what I tell my own grandmother, and I want the same for you. You can do this and do it better, and let me educate you as to how you can do that.
Let me help you.
Absolutely.
I used to work with pharmacists. They live to bust people with fake prescription. It was like that was all they was waiting on. I understand it's illegal. I've had fake prescriptions come across my counter before. First time, I'm gonna talk to you now. Come on. And I'm gonna take it. I've only had to turn in one person one time because you done came back to my counter. Now,
I've already told you. We've already had this conversation.
Right, so now,
that's like a child. Now you really got to get punished.
Right.
Yeah.
Now I don't know what to tell you. It's up from here because I try to help you,
Right.
but I understand the circumstances, and it's not always something that I had to go through myself. And I wish more people were like that. You should have an understanding whether you did it or not, and just meet people where they are.
Yeah.
Everybody don't have the benefit of the same experiences. Or I had a praying grandmother who got me, I'm sure,
Absolutely.
through some hoops and challenges. Everybody don't have the benefit of that, but let me help you in a way that you know that I care about you. And that's the beginning of it. That's the beginning and the foundation of trust. And if you trust me, you're going to listen to me.
Yeah, absolutely. So you've given some really good examples of some of the challenges and the barriers you faced on your academic path to becoming a pharmacist. I want to know about any challenges or barriers you face as being a Black female or African-American female pharmacist. You don't have to tell all the horror stories, but a good example, because I want our audience to appreciate that it makes no difference oftentimes what level of success you have, what credentials you have, all the letters and degrees you have. There are still obstacles and barriers that people, particularly diverse people, face, whether in a professional environment or otherwise, that is beyond that. And so I'd like to know, how does that, or has that presented itself for you in pharmacy?
Shoot. And I will also submit, the more credentialed you are, they might be on your neck a little bit more.
Yeah, absolutely.
And unfortunately, some of you people that we think should support us, I keep it very professional at work. One of the things that my boss says about me right now is he was like, you have a presence. You enter a room with presence. I don't do a lot of talking. I'm going to help you. If it's something that I'm responsible for, you need my help for, people can count on that. But not a lot of, I'm very professional. And some people take that as she thinks or no, it's a bigger picture that I'm out here trying to affect change in, and I got to keep my eye on that. And it's going to help you in the long run. And so that type of stuff doesn't bother me. I've had challenges. One large challenge for me was working for a boss who hid records. The disappointing part about it was you didn't even have to do that because it was something that was in my area. If you had handed it to me, I would have taken care of it. But it came out. It's a full circle moment, because the work that I do now is directly connected to this big professional blow up that I had before. And the short side of the story is the records, the equipment wasn't working properly. And in healthcare, it could be life or death. Instead of handing it over so we could take care of it, he withheld the records. Accreditation body came in, let's see these records, and then it all hit the fan. And this is my area of oversight. Thankfully, in my mind, I never saw them, so surely they were like, no, that was your department, and we think you should be responsible for it because this our friend over here, and that wasn't gonna work. That was not gonna work. I started off telling you my mom and dad, who I give credit to. My daddy is a fighter. Oh no, that's not gonna work.
Right.
And so that opened my eyes. We're always learning. What I learned at that moment, because he was a healthcare professional too, everybody's not trying to do the right thing. That's hard to accept, especially when we're in the business of caring for people. But that's not everybody's motivation. So that was an eye-opener for me. And so when we were sitting alone together, me and this person, and I'm looking at him like, don't you feel like you need to be saying something to, like...
Yeah.
And he was like, I don't know. And in my mind, I was like, oh, I know what time this is. So now it's every man for himself. And that's how I had to look at it. And that's how I processed it. It was very difficult. They tried to punish us together. Now, I told you I had never seen these to even do anything about it. But because they wanted to save him, you all, as I say, they try to get me to take somebody else's whooping. Right. Y'all, you are not going to do that to me. And so that was a year, almost a full year of scrutiny, oversight, trying to find, where did she mess up? Not the obvious perpetrator, but where did she mess up?
Absolutely.
I made it through. With transparency. I was very transparent with my employees. Thankfully, because of the trust that I had already had with them, they already knew this don't even sound like something she would do. This don't make sense. And so because of the seeds that I had laid years before, it worked out in my favor. Not to the higher ups. They didn't care about that. So ultimately, he had to go because they were like, no, y'all just take this slap on the wrist and then you come back together and I can't work for you after this. I'm a licensed professional. Somebody could have been harmed. I can no longer trust you. No, we are not coming back sitting in this seat like nothing happened. Somebody could have been harmed from my department. And so after the smoke cleared, I was still there. He was no longer there. Then why does she act like she don't act like she grateful? Grateful for what? I didn't do anything. And y'all made me go through hell to prove that it wasn't me.
Yeah.
And I had to fight for my own rights to not be violated.
And my own name and my own reputation and my own license.
I'm a
this
licensed
is my career.
professional.
Absolutely.
If I lose my license for some nonsense,
Absolutely.
and I don't know that could happen, but I don't know that it couldn't happen, I'm dead in the water. And so then you out here talking about I'm not acting grateful. Oh, let me tell you something. So I knew, no, this is not it. I could have done everything y'all said that I have done, and I wouldn't be groveling. I'm
number one.
Joe's daughter.
Right.
But I know I didn't do it. Oh no, we're not going to do that. And many people in leadership applauded my efforts because they were so used to us just rolling over and just taking it because this is my good government job. And I had to say, I need to work, but I don't need to work here.
Right.
So I'm going to stand up for myself and let the chips fall where they may.
Yeah.
But no, you're not going to do me like that.
Yeah.
And people just think that you have to, if you have the credentials and my people, they want me to act a certain way, then other people think it's just like a tight rope to walk. I can't be like laughing and kicking with y'all in the lunchroom because that's not my role.
Right.
But I also can't act like I'm so far removed from it and not understand what's going on
with your people. Yeah.
I don't think people understood. I'm sitting in these meetings, just me, for you. And it's not playtime. And that was the weight that I carried. I feel like all the way up until I got here to I love Eskenazi. The culture. I don't feel like that. I'm sitting here carrying the weight and walking this tightrope. I gotta be this way and present myself in a certain way, but still be aware and abreast of what's going on over here. That's how I felt up until this stage in my career. But I also think that huge blow up and then the way that I looked at my life is different. I stepped out of titles and taking on employees at the time when most women my age, that's all we want to do. We want to be on this board, that board. I want to have 33,000 employees. I was like, that's not what I'm worried about. I like flexibility. I like to do what I want to do when I want to do it. I want to be helpful, purposeful, impactful. Let me help somebody. I don't need another title. I've been doing this for 20 years. And so all of that shapes your perspective. Mm-hmm. And I feel like this job was God ordained for me, for what I needed at that moment. I had union employees, like when you supervise union employees, baby, like they're going to put your shoes. I had a master agreement this thick that I had to know frontwards and backwards. I was like, I want to be an individual contributor at this time and still be a leader and still be impactful.
Yeah.
And so that was born out of the challenges and the targets that you have on your back every day that people don't see. And they wondering why she acting like this or why she isn't she doing this or she don't look like. I'm walking through this whole thing about what I'm about to walk into.
Yep. Yeah. So tell me, because I totally appreciate all that. I know it's real, but tell me how you carry that weight, show up for your people, show up where you need to show up for your teams, etc., but still give yourself the freedom and the flexibility to be authentically Katasha, authentically you, show up in a real way, but still be able to be the leader, be the person who has to make the tough calls, carry the challenges, all that. How do you keep that authenticity real in a way that allows your people to also feel they can be comfortable with you or in their workplace?
Like I said, that ordeal was it was like a year long. And ironically, there's this program in the federal government, and I was in it. And it was like the top 100 leaders in the country. And they're training you to be what they call SES. So that's your medical center directors, chief of staff, the top people at the medical centers.
Right.
I'm in this program. And I got accepted in the program, and then all this stuff pop off, and I'm still in the program, and I'm going through it. And so I remember we were doing a mock interview, and somebody asked me a question, and I burst into tears sitting there in this interview. It didn't have anything to do with the question, but it did. And it was all of what I had been carrying and showing up for my employees and still fighting this battle for myself, almost in isolation. I had people in my life that I could talk to, but once you in it, nobody really know how much of a weight it was. And I don't even remember what the question was.
Right.
But my mentor, and he was a network director, he was like, girl, you have been battle tested. And he knew to call in some other Black women leaders in this agency. They came and talked to me after that interview, after all of that happened. And they have been mentors and supporters then, because they can understand. And they had been through some things.
Yeah.
And so you don't even realize how much weight you're carrying for everyone else.
Yeah.
And what I did, that probably was all of this stuff is important, but what's really important is what's important for you and how to live and how to process. So I'm no longer willing to I'm not willing to do that anymore. And if that means I cannot have the C blank title, I'm okay with that.
Yeah.
Because I need me to be okay.
Yeah.
In my regular full life.
Absolutely.
And people don't, like, I probably shared that with some of my employees because people don't even see it. They just see she just moving forward. She keeps moving forward. Department's still moving forward. I know she's talking to us, but that was a weight, a betrayal, but you still got to show up for the day. My favorite phrase, I would tell them, we have these missions, visions, and goals, and ultimately we got to get the medication to the patient. That's what we would say. Get the right medicine to the right patient at the right time. That was me. That's what kept me. That's what we here to do.
Yeah.
And it's a lot. It can be a lot. And that's why I prayed for my next role. So I left that role. I didn't have a job. They were shocked that I left without a job. But I was like, I'm going to take 4 months off. I'm going to chill for the winter, and then I'll look for a job. I ended up getting a new job, like, way before I wanted to take it. I was like, I want to start this early, but it worked out that way. But I was like, I'm taking time for me.
Yeah.
Like I said, I need to work, but I don't need to work here,
Right.
and I'll be okay.
Yeah.
But I prayed for what I needed. I don't need to just come back. If we get downsized or fired or we leave a job, we want to show up at our next thing. Oh, I done popped. I've improved. I got a better title, bigger this, bigger that. For me, it's not even about that. I really sat down, what do I need for me? All my peers out here want to be see this, see that. That ain't what I want. I want to pick up and go to Paris when I feel like it. I want to be able to go to my niece's recital when it's time and go have lunch with her in the middle of the day because they have family lunch at her school. That's what's important for me. And I don't have to come out here. She left this role and now she doing it. No, I was like, what do I want? I've been a people leader for 18, 19 years. I don't want to do that anymore.
Yeah. And typically that kind of self-reflection happens, particularly for diverse women and Black women, after a crisis. It never happens. Because we're just carrying all the loads for work, family, all the things, just plowing through one crisis after another until you realize you are mentally, physically worn out, or your body gives that. Body makes you slow down because
I'm not trying to be there because it will sit you down.
Absolutely. And we're certain I am so much more conscientious of that now just because I'm getting up in age and I realize I can't pull all-nighters like I used to and I can't be up or just whatever. And so that's real because I'm a lot more conscientious that my body is going to tell me sooner than later that you will slow down.
Oh, good night. I'm a night owl. I could be up all night and get stuff. Now I'd be like, good night.
Yeah, absolutely. Or my body says it's party over. Like, you're going to get some rest. Okay, so Katasha, this has been so enlightening. I have one final question for you because you've been in Indiana for so long, but have come from, you said you're a native Illinoisan. I want to know what resources, tools, opportunities would you share with our audience about continuing to ensure that our Indiana healthcare and hospital systems do continue to be diverse, and not just diverse in leadership, but diverse in making sure diverse patient populations have the best outcomes possible. We know that Indiana struggles with maternal mortality. That's an issue. How can we be better in that regard? What can our Indiana hospital or healthcare leadership do to actively ensure that Indiana continues to be more diverse, more inclusive of all patient populations?
I think Eskenazi is a leader in this area. We need to start from the bottom. The EVS worker is just as important as the CEO. When you go into a hospital, you're like, is it clean? Does it feel clean? That instills confidence.
Right.
I love the building that we are in at the downtown campus now. We have Grand West. They look phenomenal. We're so used to treating the people who don't have the ability to pay. You just get what you get. And it's a lot of us high earners, they operate in that same mindset. They should just be glad for it. No, don't do them like that. They should not just be glad for it.
Absolutely.
They should be able to have and enjoy the same things that I would as someone who pays the full ticket or whatever. I like the way it looks, and that makes them feel comfortable. I'm not just here, just getting what I can get. I think that we need to it's about empathy. It's hard to talk about this without talking about everything that's going on with SNAP benefits and all of that. By the grace of God, go I. I think people have gotten from this podcast. I grew up in a nuclear family with working parents who took care of me all the way up until they didn't have to. But before affordable health care, you remember when you get kicked off your parents' insurance when you turn 18, and then if you were in college, you got to stay there until you were 21. So I'm in pharmacy school for a long time. I had to get on Wishart Advantage as a student so I could have access to health care. So that was me. It wasn't because that's just the circumstances. I know what I had to do to navigate it. That means I got to call my prescriptions in 3 days in advance because they're overwhelmed by the number. Then that's what I'm going to do. So I know what it's like to be a part of that and do what you need to do to make it work. But I'm doing it with car, parents, support. Some people don't have that.
A lot of people don't have that.
A lot of people don't have that. I could just roll down there when it's time. Everybody doesn't have that freedom. They got arranged childcare. They working 2 jobs. They don't have time to do it.
They got to get on the bus. They got to make it work.
Several bus stops.
Absolutely.
Right. When I was in managed care, I got in a wreck and I had to get an MRI. It was my first MRI. And I was like, oh, y'all got to let me out because I'm a little claustrophobic in here. And I'm laying in there and I'm thinking, we're not on because I didn't make the rules, but I enforced the rules. We're making people go through all this to get some medicine. And that opened my eyes. We need to be barrier breakers.
Yeah.
We need to make it easy and seamless. When you come in, there's a smiling face for you. When they come in, if you don't speak Haitian Creole, we can get somebody here to do it. And I think those are the important parts. So what we do is we're making sure that our residents are diverse, our practitioners are diverse. When you come in, that you can feel welcome. You can feel like there's somebody who will understand you. At one point in time in Indianapolis, we had a lot of Russian immigrants. And I remember working in that area. We were there with the tools that we needed to help them. So it's not a black and white thing. It's a meet people where they are as a human.
A human dignity thing.
And if you have Black, brown, healthcare professionals, technicians, EVS, HR, it just works better for what you're trying to do. If you're saying you're here to impact change and help the patient population that you serve, then you should be on board with that.
I think that's so phenomenal. I think that's a mic drop moment. I want to stop right there and just tell you thank you for everything you do, for everything you represent, for all the challenges you've overcome to get to where you are. I'm so excited to finally have this opportunity to speak with you. And thank you for being on the Freedom Forum.
Thank you so much.
Thanks again to Dr. Katasha Butler, and thanks to you for joining us on this 47th episode of IBJ's The Freedom Forum with Angela B. Freeman. Please come back next month for another conversation about diversity, equity, and inclusion in the Central Indiana business community.